So my name is Dr. Joseph McHale. I'm a hematologist at Mayo Clinic in Arizona. My Twitter handle is @jmchaleMD, and I had the privilege of chairing a session here at the American Society of Hematology annual meeting entitled Social Media for the Hematologist. So as the chair of the communications committee, we had the privilege of putting together a session that was designed to introduce individuals to social media and specifically to Twitter. We wanted to focus on Twitter because it's one of the platforms that is so extensively used for our professional means. So we gave an introductory talk. Mike Thompson, who is so well known for his work in Twitter, gave us an overview of the significance of Twitter and how it can be used in various professional contexts. And then we did a series of interviews with 5 hematologists and patients, actually, who were able to share with us how they use Twitter for research, for education, for patient information, for patient advocacy, and to inform their colleagues as they travel to other meetings. We had a wonderful session. We had about 500 people in attendance, and we trust that it would be of real value to the hematology community. Well, I think the beauty of social media is it's very personal. It's very individual. I wouldn't force anyone to do it unless they don't want to do it. There are a lot of forms of social media that people can enjoy personally, most often things like Facebook or Instagram. Professionally, people tend to use LinkedIn to be a conduit to connect to individuals. But the reason why we focused on Twitter today and why we think Twitter is so important is this is really a novel means of being able to communicate information in a short, pithy way across borders very rapidly and very much in real time. Meetings like this, where if we waited for everything to ultimately be published and put into peer-reviewed journals, which of course is a process we would never want to undermine, but if we waited that long, we'd be waiting a long time to understand the way science is moving and the way the field is moving. And so the session today was designed, and what I encourage people is to consider being involved in Twitter, to tweet out things that are going to be of value to our patients, that are going to be of value to our colleagues, that allow and foster an opportunity to collaborate more effectively as we retweet other individuals' tweets, as we have an opportunity to read what has been said. It really is unprecedented as a platform to be able to connect physicians and allied health together, to educate our patients, to educate each other in a way that can be a big part of your career or a small part of your career. That's the beauty of it. It's not like when people sign up to it, they have to commit their life to it, that it can be tailored to their individual wishes. Well, social media has been a great benefit for me personally, and particularly in Twitter, as it's allowed me to connect to many of my myeloma colleagues, for example, and myeloma patients in a forum that otherwise I wouldn't be able to. Many people can't attend all of our live meetings. Many individuals obviously have to stay behind and they're caring for patients. So it's an opportunity to be kept up to date in the latest of what's happening with drug approvals and novel treatments and scientific research that's going on. And it built a community with us. Individuals who follow me can learn a little bit of what I think is valuable and important at a meeting like this or at various educational or scientific sessions. It's an opportunity to inform the public, as it were, in general, around the kinds of clinical trials that we're doing. We have a huge clinical trial network at Mayo, of course, and so this is one of the means by which we educate people who may be interested in coming to be enrolled in a clinical trial or to receive their medical care from an expert in the field. That's really just the tip of the iceberg. We could talk all day about the various methods by which Twitter can be used to benefit individuals' careers, but we want to just give that sort of pithy overview today, and I think it was very effective, and I hope people listening will consider it. It's a very easy thing to set up an account. It can be done in just a few minutes, and it can allow people to obtain the information they want and send out information that they want in a very individual fashion.